Fibromyalgia is characterized by chronic and widespread pain and stiffness, fatigue that leaves you feeling like every bit of energy has been drained from your body, cognitive dysfunction or brain fog, and in many cases insomnia. Fibromyalgia affects women 9 times more than men, and unfortunately because of this many doctors will disregard their complaints because they assume that the patient is depressed or unhappy with their lives. This leads to a misdiagnosis and incorrect treatment recommendations in the long run. The misdiagnosis comes from the fact that fibromyalgia is diagnosed purely by symptoms and not by objective findings such as lab values. Basically, the doctor asks you if you have pain in certain areas of your body and if it's lasted for more than 3 months. If so, you have fibromyalgia. This raises some important questions. How can an accurate diagnosis for any health problem be made purely on subjective findings such as symptoms of pain and not supported by objective lab findings? And given that fibromyalgia includes cognitive impairment or inability to concentrate, problems with short and long-term memory, depression, and the fact that pain is experienced in the brain and not actually experienced in the body, the question is the problem in the brain? Much of the research today points to a process called central desensitization, which means the brain is overly sensitive to the pain signals that it receives from the body. This increased sensitivity in the brain to sensory signals can lead to pain from just a touch on the shoulder. Take a look at the information I have below for more detail. The conventional approach to treating fibromyalgia is to prescribe drugs such as Lyrica and Cymbalta. These drugs affect the level of serotonin and norepinephrine in the brain, and they carry a host of side effects that include dizziness, blurred vision, insomnia, unexplained weight gain, swelling of the hands, the feet, and the face, anxiety, aggression, depression, and in some cases suicidal thoughts. Only you can decide if these risks are worth the side effects. Our approach to fibromyalgia is a neurometabolic approach. It starts with a comprehensive neurologic exam, which includes looking at brain function. We also do an extensive lab evaluation that looks at more than just the typical blood profile, which is very limited in its scope. To learn more about our approach, make sure to visit our approach page where I explain these procedures in detail. Thanks for stopping by.